everyone, my name is Emily Rutledge. I'm a student physical therapist assistant from Jeff State Community College. Today I'm here to discuss my orthopedic treatment plan. I'm here with Daniel Lundberg, who has just had a total knee arthroplasty 4 days ago in his right knee. In this presentation I will be discussing some of the components of his rehabilitation, including soft tissue mobilizations, patient education, home exercise program, and the overall prognosis for this patient. Mr. Lundberg is a retired school teacher who stated in his primary goals for physical therapy were to return to gardening, which is his main activity, and to go up and down the stairs in his two-story home. His medical history is unremarkable, and per the doctor's orders, he is weight bearing as tolerated with a walker currently. At the initial evaluation, he had some acute inflammation and edema in the right knee. His range of motion was limited by pain and an abnormal capsular infeel, which contraindicates tibiofemoral joint mobilizations per the PT. And his impairments of range of motion and decreased strength in the right leg, secondary to the surgery, are limiting to his mobility. Each session, we need to address his symptoms with activity, and as well as his adherence to his home exercise program that involves independence. Two other things that we need to address in each session are knee flexion with goniometer to measure flexion extension range of motion, as well as we need to measure the circumference around the suprapatellar border and the infrapatellar border to monitor the edema. Okay, so to begin his treatment, we are going to do some soft tissue mobilization. We're going to do this to the right hamstrings, muscle belly, and we're just going to be using longitudinal elongation. We're going to stay away from the insertions of the hamstrings because of the localized inflammation. So I'm just going to be working along the muscle bellies, paying attention to adhesions and restrictions and treating those as I see them. Mr. Lundberg, how are you doing?
Good.
Okay. And when I find an adhesion, I'm going to use sustained pressure. Okay. And we would do this manual therapy for about 10 minutes, 10 to 20 minutes. And we can go up into the origin at the ischial tuberosity and do some transverse friction. And we would do that for about 15 seconds, right over the tendon. And then let that relax. And we would do that 3 to 5 times. Does that feel okay?
Mm-hmm.
Great. Okay. So after we did the soft tissue mobilization, Mr. Lundberg, I'll have you turn over. I'm going to teach this patient a home exercise to perform. And Mr. Lundberg, what we're going to be doing today is called quad sets. This is going to help you improve the range of motion in your knee to get it so that you can fully straighten your leg, okay?
Okay.
So you're still having a little bit of restrictions with that. So we want to start by putting a roll underneath the ankle. Okay. And what I want you to do is tighten your front thigh muscle like you are trying to push your knee into the table, okay? Great.
Like that?
Just like that. You're going to hold that for about 2 to 3 seconds each time. And I want you to do 3 sets of 10. And you can take a rest in between the sets. 3 sets of 10, and I want you to do that 3 times a day.
Okay.
Okay? And if it starts to hurt, or if you start to feel any increase in symptoms, as you do sometimes as you increase your activity, I want you to stop. I want you to stay within the pain-free range. Okay?
Okay.
Do you have any questions about how to do the exercises?
No.
Okay. All right. Great. And then also for this patient, I'm going to discuss with him education regarding rice to manage the inflammation and edema that was present at the initial evaluation. Because this is limiting his mobility and range of motion, I think that is primary to address. So, Mr. Lundberg, I'm going to teach you about RICE.
Okay.
That stands for rest, ice, compress, and elevate. And we're going to do that to your right knee. Okay?
Okay.
So, first, we're going to compress it. This is going to help to reduce the swelling and edema that you've been having here. Okay? So when you do this, I want you to start below the knee. And I want you to wrap it tightly. And then as you get towards above the knee, I want you to wrap it a little bit more loosely.
Okay.
So more tight away from the knee, more loosely above the knee.
Okay.
Okay? And you just want to make sure that there's no wrinkles when you wrap it. I want you to change the wrapping 2 to 3 times a day.
Okay.
So you can inspect your incision. If your skin below your knee is dark purple, red, blue, I want you to unwrap it immediately, as well as if you're starting to have more symptoms of pain, numbness, tingling, okay? And that will help to reduce the swelling that you have there in your knee, and change it 2 to 3 times a day.
Okay.
Okay? So after we compress it, we're going to elevate it. Okay? Just lift your leg. And you can lie down. Yeah, perfect. Now when you elevate, I want you to keep your knee straight because we don't want to have any more tightness restricting the back of your legs, okay? So I want you to keep your knee as straight as possible with the pillows, okay? And then we're going to put ice over it.
Okay.
Okay? And you can leave the ice on for about 15 minutes at a time, and that will help with the pain and also the inflammation, okay?
Okay.
You can do that at home. Here is a handout detailing the exercises that we did, as well as details about rice, okay? Do you have any other questions for me, Mr. Lundberg?
I don't think so.
Okay, wonderful. Thank you for participating in your therapy today. So the overall prognosis for this patient is good. 90% of the people that have total knee arthroplasties experience 10 to 20 years of functional activities with their knee. Because this patient's history is unremarkable and he did not have any comorbidities, the prognosis is good. There may be some education regarding energy conservation techniques. Since his main activity is gardening, we may talk to him about taking frequent rest breaks and avoiding prolonged positions to modify his activities. So thank you for listening to my presentation today. Have a wonderful day.